Hello everybody, and welcome to the Tuesday edition of Video Clips. As usual, just a couple of announcements, and the first one is we have a Women's Health Symposium at the end of this month on April 29th. It's here in Columbus. If you're in driving distance of Columbus, you definitely want to be here. Well, I mean, I guess you want to be here if you're female. I don't know what we'll do if a guy tries to register. We've never had that happen before. But anyway, Women's Health Symposium, we're going to cover hormones from early childhood on through menopause and all of the related health issues, bone health, breast health, all kinds of things. So great lunch is included, so be here. You'll be glad you came. And you'll get to meet all kinds of other cool people from Wellness Forum Health membership. All right. Second thing, summer semester actually is starting early this semester. We're going to start in May because we offer statistics every couple of years. And there are 2 semesters of statistics, 1 and 2. You might wonder, why am I telling you this? Well, why I'm telling you this is the secret to being able to analyze medical information is being really good at analysis, and you need statistical training to do that. And we have the best stats teacher in the entire world. His name is Dr. Ron Lewis. He's the Institute's favorite teacher. They like him better than me, and I don't mind because I just want people to learn this information. So anyway, these are long classes. So we start in May and we go through to Christmas with Stats 1 and Stats 2. So if you'd like to know how to do this, I promise you will love it. People always say, yeah, I'm going to love statistics. Trust me, everybody who has taken this class from this guy loves statistics. So sign up. I'm going to teach cancer, nutrition, and treatment-related issues summer semester on Monday night, and the diet and lifestyle intervention course for healthcare providers and lay people features the celebrity instructors during the summer session, which include Dr. Esselstyn, Dr. Barnard, Dr. Goldhammer, Dr. Moss, Dr. Schultz, some people who you rarely get a chance to be live and interactive with in our virtual classroom teleconference format. So that's what I have to say about announcements. Now, today I want to talk about something a little outside the box. A new trend is the opening of salt spas, which offer something called halotherapy and salt caves. The word halotherapy is derived from the Greek word for salt, which is halo, and halotherapy involves using salt vapor to relieve symptoms of several conditions, including respiratory disorders such as allergies and asthma and skin irritation. The use of salt as therapy is not new. It dates back to the ancient Greeks. Hippocrates, I guess a lot of things date back to Hippocrates in the healthcare field, but he used salt for a lot of purposes, including the inhalation of salt water as a treatment for respiratory conditions. In 1843, a physician in Poland observed that salt miners in Poland had a very low incidence of respiratory issues. And during World War II, a doctor reported that his patients improved while they hid in a salt cave in order to protect themselves against aggressive bombing in the area. The people who hid in the caves reported that their coughs resolved and they were able to breathe more easily. The Russians were the first to develop the technology to duplicate salt caves in therapeutic type environments, and salt caves or rooms were first built in the United States in the 1990s. So they've been around for a long time. I had never heard about them. I've heard of salt therapy, and I'll give you some more background on that in a second, but I had never heard of an actual place that you go for salt therapy back in the 1990s. In fact, it wasn't until recently that I got turned on to this idea by one of our business partners. So, to give you a little bit of background on the use of salt and saline treatment for therapy, saline solutions have been recommended for upper respiratory conditions for many years. In fact, I was able to find an article in a 1902 issue of The Lancet, which advocated just such uses for salt. A 2009 survey of family practice doctors showed that 87% of them had recommended salt treatment for 1 or more conditions. Salt has been shown to have a positive effect on people who have atopic dry skin. In fact, soaking in water that contained dissolved dead sea salt moisturized the skin, reduced roughness and redness, and lowered inflammation in patients who had dry skin. Saline irrigation following sinus surgery has been shown to reduce secretions, reduce the risk of post-operative complications, and accelerate mucosal healing. I mean, who knew there was this much background on salt? And one thing I have to tell you, I've done some research on salt, and you've heard me talk about it on this YouTube channel and a number of different, with issues mainly related to salt consumption and heart disease and some of the myths around that idea. But when I started looking here, the problem wasn't that I couldn't find information. The problem was paring it down and trying to pick the best of it, because there's quite a bit. Salt caves have been used in Eastern Europe for a very long time for relief from chest conditions. The practice there is referred to as speleotherapy and involves recreating the environment of a salt cave for therapeutic purposes. Therapeutic salt rooms or caves are warm and slightly humid. Dry sodium chloride particles are infused into the air, and the environment is free of other types of pollutants. The therapy has been shown to help most people who have breathing problems and to help patients with asthma. In fact, several studies have shown salt aerosol therapy to be effective for treating asthma, including a review conducted by the Cochrane Collaboration. Halotherapy also helps patients with allergic asthma, infectious disease, and inflammatory conditions. A study of 193 patients and matched controls with respiratory disease found a significant improvement in symptoms with the use of dry aerosol over placebo in 85% of mild and moderate cases, 75% in severe cases, and 97% in chronic bronchitis. Common colds during cold season were reduced by 50%. There are several mechanisms of action for salt therapy. I'm always encouraged when I see these types of things because it adds strength to the correlations, which include cleansing of nasal passages, removal of inflammatory mediators. Many randomized controlled trials have shown saline irrigation is an effective treatment for sinusitis. And in 2007, a Cochrane review showed that saline solutions were beneficial when used for this purpose, either as adjuvant treatment or even when used by themselves. And one of the reasons I think this is very important is that we overprescribe antibiotics in the United States and westernized countries. We do it a lot less than we used to. I have to give the medical profession credit. They are trying to reduce prescriptions for antibiotics, but sinusitis is a common reason why antibiotics are prescribed. And my gosh, if we can treat it with saline solution instead of drugs and antibiotics, that's a wonderful thing. Cystic fibrosis patients in particular may benefit from halotherapy, since studies have shown that hypertonic saline therapy reduced an improvement of lung function, increased ability to engage in usual activities, and reductions in the number of exacerbations, antibiotic prescriptions, and absenteeism from work or school. Now, I tried this myself. I visited a local Columbus spa with one of my business partners who recommended it to me. Now, I don't have any allergies, don't have asthma, didn't have any breathing problems that I was aware of, but was just interested in checking the place out because I like to do that before I would refer anybody else to it. So when I went, the room was warm and comfortable, and I was placed in a reclining chair and covered with a blanket. The lights were dimmed and they piped in soft music, and I fell asleep during the 45-minute session, and after it was over I felt refreshed, but I essentially attributed that to the rare opportunity for a midday nap, which I don't usually get to do. But what happened in the next few days was very interesting. I was really surprised to notice that my sense of smell had improved, quite a bit in fact. Scented candles smelled a lot stronger, and the scent of food was a lot stronger, both here at the office where we have Wellness Farm Foods, and also when I was even cooking food at home or eating in a restaurant. Apparently my nasal passages did need some cleaning out, and the salt treatment did that. So I've since been back several times, and I've recommended the therapy to a number of different people, not just here in Columbus, but all over the country. And one thing that I found very interesting is that almost everybody who lives in a somewhat large city has been able to find something like this nearby. So these salt spas really are doing well. And I talked to the owner of one here in Columbus the other day who said she's busy every hour she's open. So I always like to see things that are effective do well, so I'm glad to hear that. Not all studies, by the way, that looked at halotherapy have shown benefit, and I cited one here in this paper. But I don't see any reason not to try it if you have any issues that I've talked about, ranging from just simple breathing difficulties to something as serious as cystic fibrosis. Not much can go wrong, and it often, according to research, is helpful. And at the very least, you'll have an opportunity to take a therapeutic nap. All right, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it. This article will be posted in the Health Briefs library by the time you see this video clip, and I'll be back to you on Thursday with more news.